I put vote 18, health. Accordingly, I've been informed that there would be declarations made by two parties, which is MK Party and ANC. I'm now inviting Honorable Mokoena to take the floor.
Thank you, Chairperson. The MK Party yet again rejects vote 18, health, and we do so without apology. This department has failed the people of South Africa. It has failed the sick, it has failed the poor, it has failed the elderly over and over again. Let us talk about Tembisa Hospital, which used to be shiny and mighty. Today it is overcrowded, it is understaffed, and it is falling apart thanks to the ANC. Let us talk about the previous Edendale Hospital, now known as Harry Gwala Hospital in Pietermaritzburg. Once a hope for rural communities, now it is a site of decay and despair, thanks again to the ANC government. Public health care in the country is not getting any better, it is getting worse. And this government has no plan to fix it. Every year we hear about the dream of the National Health Insurance, but let's be honest, the NHI is still just a dream. The clinics are not ready, the systems are not working, corruption is everywhere. You cannot build NHI on a foundation that is already falling apart. And while the ordinary South Africans are forced to wait in long queues for hours, the Minister of Health still uses private doctors, still has a medical aid, and still skips the system that he wants the rest of the country to rely on. The day the minister cancels his medical aid and uses a public clinic is the day that we'll see and will believe that he trusts the system that he is promoting. The day the members of this House, members of Cabinet, go to Tembisa, go to Harry Gwala, go to Dora Nginza for treatment is the day we will know this government is serious about public health. Till then, it is all lies. And let us not forget the corruption. During COVID, our nurses were running on thin for PPE. Hospitals ran out of oxygen, ambulances had no fuel, but politically connected companies made millions, and not a single one of those has been incriminated today. Chairperson, this department should save lives instead of draining them. We cannot keep throwing billions at a broken system. We cannot keep funding failure. This is not a budget, it's a bailout for mismanagement. The MK Party stands with the people of South Africa. We want a healthcare system that works for everyone. Until then, we say not one more cent. Thank you.
Can I invite Honorable Sibande to take the floor? Honorable Pat Sibande. Okay. My apology. I didn't see the note that he has sent me that he is withdrawing. Honorable members, the vote is now agreed to. I'm informed that the EFF and the MK Party have tendered their objections, and accordingly, the objections are noted. I put vote 19, social development. I've been informed that the following parties would like to make a declaration of vote. Freedom Front Plus, as well as ANC. I'm now inviting Honorable Priet to take the floor.
Thank you, Chairperson. This department and its entities have been marred by scandals for more than a decade. It was estimated that between 2012 and 2013 financial year to 21-22 financial years, SASSA lost more than R500 million due to 1,174 people unduly benefiting from receiving social grants through fraud and/or corruption. Between September 23 and January 2024, 13 officials charged with corruption in the Gauteng Department of Social Development returned to work on full pay. Not a single one faced disciplinary hearings, despite several children's homes, including Johannesburg's biggest food bank, having to close its doors. In 23-24, SASSA paid over 140 million rand in grants to deceased beneficiaries, citing a reliance on citizens to report a death. meaning that as long as a beneficiary's death is not registered, payments could be received by non-qualifying beneficiaries. In KZN, during the 24-25 financial year, a staggering 889 million rand in irregular expenditure and 3.9 million rand in fruitless and wasteful expenditure was flagged by the Auditor General for the Department of Social Development. It must come as no surprise when we learn that despite suspensions, some of the accused were paid 14.6 million rand by the KZN DSD. These payments included 13th checks and leave payouts. Other officials also in the KZN region were reinstated in their positions after being accused of multiple cases of misconduct relating to PPE procurement. In May of this year, a whopping 1.3 billion rand in irregular expenditure was recorded in Gauteng's Department of Social Development. Then there is the gold to black card switch. The original deadline suggested for the project was set for 28 February of this year. It was extended not once, not twice, but 4 times due to insufficient administration and a plethora of communication breakdowns. And today we are dealing with grant reviews, but beneficiaries are not being informed. Grants are simply suspended. Officers that have to update details are indefinitely updating their data capturing systems, and the nearest other SASSA office is more than 60 kilometers away. Although the VF Plus supports this budget means nothing if there is not adequate consequence management, responsive leadership, and boots on the ground action. I thank you.
Thank you very much, Honorable Breed. Can I invite ANC in the name of Honorable Finis to take the floor?
Thank you, Honorable Chairperson. The ANC stands today to declare full support for the 2025-26 appropriation budget for Vote 19 of the Social Development. The allocation totaling 294 billion for the coming year is a decisive step in ensuring the continued social protection and empowerment of South Africa's most vulnerable citizens. The Department of Social Development remains the front line in the national commitment to eradicating poverty and reducing inequality. Through this budget, 45% of South Africans, more than 18 million people, will continue to access vital social grants and support services. These include the old age grant, the child support grant, disability and foster care grants, as well as the temporary social relief assistance. The increases approved for core grants will soften the blow of the rising cost of living on millions of households. Supporting this vote is fundamental for consolidating social stability, advancing human dignity, and fostering social cohesion. Grants give primary income support to children, the elderly, people with disabilities, and others who would otherwise be destitute. Furthermore, this allocation supports essential programs addressing gender-based violence, substance abuse, services for the elderly, and those living with HIV/AIDS, and innovative community development initiatives. Our backing for this budget also backs much needed reforms to enhance efficiency, reduce fraud, and ensure sustainability. Funds are earmarked to strengthen biometric and income verification, fight social grants fraud, and digitize appeals processes. The investment in non-profit organizations' recognition and community development fosters grassroots partnerships and empowerment, giving rise to sustainable livelihoods beyond dependency on grants. It is crucial to note that while fiscal pressures persist, this budget continues to prioritize and protect those most at risk, defending the integrity and sustainability of our welfare system. Honourable members, the social development allocation is an affirmation of our constitutional and moral responsibility to ensure no South African is left behind. For all these reasons, we as the African National Congress support Vote 19, for it is in the best interest of our people and our country's future. I thank you, Chairperson.
Thank you very much, Honorable Finis.